students. We are coming to the last part of the chapter Human Health and Disease, that is drug and alcohol abuse. So let us start the topic drug and alcohol abuse. According to WHO, actually the drugs, they are not used only for the personal excitement or antidepressant or some another causes. It is generally also taken as medicine. So rather we will call this as abuse, we will call this is as dependence. Okay, so drugs and alcohol dependence, what is that? See, nowadays not also nowadays, from earlier time also, like from around 1000 years back also, from different plants or from different insects or from different animals, small animals like insects, different type of chemicals, inflorescence, different parts of the plants, they were extracted for some medicinal purpose. They were taken from different parts of the plant, and after that it is taken in the medicine. It can deactivate the lots of pain that occurs in our body. Nowadays also in medical science, for after suppose surgery had done, different type of drugs are used. Okay, so those drugs, they are very much helpful in the medicinal point of view, but other than different other type of drugs, they are misused by all group of ages, but it is very common in the teenagers. Why? Because teenagers have one problem, that they want to show themselves as adult in the peer pressure. So that's why they used to take those drugs to show that they are now completely become adult. They can take all the type of or they also have all those intention, where actually the peers, friends, they give the that pressure in the mind, that in peer pressure the people used to take the those type of drugs as well as alcohol. And in a long period of time, if that individual, if that child, or if that boy or girl get dependent on the drug, it can cause lots of diseases, and also it can cause basically the mental imbalance. Then also he will have neural problem. Also it can cause a lot of other things, not only physical but mentally, socially, emotionally, he will be completely imbalanced. So that keeps the individual's health, destroys the health, and this way it can kill the whole individual. Most of the time, if that individual is already suppose dependent on the drug and alcohol, and after that if they suppose want to get rid of it, or if they want to stop those chemical to take, then also they cannot. If they suppose withdraw, then this withdrawal also can cause in ultimate cases death. Okay, so that's why lot of nowadays awareness are there, lots of centers are there, where the consultant, they actually give proper stages how they can get rid of all those drugs. So but due to different purpose, the people, they can take the drugs, okay, and can become addicted. Now we will see from all those type of drugs, various type of drugs are there. Synthetic chemical drugs are also here, but yes, also from the organic compounds, like from the flowers, from the plants, as well as from the insects of the paddy field or from the crop field also, some type of chemicals are extracted. So from all those type of chemicals, we will see basically three different type of drugs. We divide the drugs in three parts: opioids, cannabinoids, and coca-alkaloid or cocaine. Okay, so we will see all the differences, and also you have to know their characteristics. Okay, so first of all, see, this is opioids. This is also called as opium, right? So what is opium? It is actually binds to the central nervous system and the gastrointestinal tract. whenever one individual takes that opioids, it goes to the body. Inside the body, it binds to the central nervous system, as well as it can bind to the GI tract, gastrointestinal tract. Basically, this opioid, this is extracted from the latex of a poppy plant, and that poppy plant, scientific name you have to remember, this is Papaver somniferum. Next one, see, it is an analgesic, very much important. What is analgesic? Analgesic means it is a painkiller, right? So as it is acting as a painkiller, so that's why after the surgery, the individual who have undergone surgery, he can take this as a medicine, okay, so that it can decrease the pain to certain extent, right? So now different type of examples are here, different areas, different localities. This opioid are named differently. What are they? They're heroin, smack, or morphine. Morphine is very much common. Morphine, smack, heroin are some example of opioids where it is acting as a depressant. Why it is acting as a depressant? Because it slows down the body activity, right? It decreases the rate of breathing, it decreases the metabolic reactions of our body, and that's why it will decrease also cardiovascular activity. And because of that, this individual can get deep sleep, right? Can get deep sleep because of this drugs, that is opioids. But very often this morphine or smack or heroin, that is taken as a drug also, not prescribed by the doctors or not after the surgeries, that is taken as a drug, right? But it is acting as a depressant. Suppose that individual have some excessive excitement or anxiety, then he takes those things, or in just peer pressure they takes this type of drugs, then it act in the central nervous system and in the GI tract, okay? Remember that it is acting as a depressant. Other than opioids, the other two, they are not depressant, they are the antidepressant. Only opioid is a depressant. Remember why? Because it slows down the body activity. How it slows down the body activity? The rate of breathing will be decreased from suppose 14, 16 time, it will be decreased to 10 time, 12 time. The rate of breathing will be decreased, along with that blood pressure and the cardiovascular activity will also be decreased. So it can induce sleep also. So this is opioid. After that, the next type of drug we will see, that is cannabinoid, right? So what is cannabinoid? It is actually extracted from a plant that is known as cannabis sativa. Now see, it binds to the receptors of the brain. In our body, the brain already has some receptors. With those receptors, these chemicals bind, and whenever it binds, it acts as a stimulant. It works on the cardiovascular activity, and suddenly that individual feel that feeling of excitement and anxiety. It's a feeling, excitement, or it accelerates the cardiovascular activity. It acts as an antidepressant. He forget his all emotional depressions and can excite once again the individual. That is cannabinoids, right? So these cannabinoids receptors are present in the brain. Remember that it is extracted from the plant cannabis sativa. Now from the cannabis sativa, from the inflorescence, this cannabis is extracted. Now after that, it is how it is taken. It is actually white in color, it is odorless also, and it is taken generally by snorting. It will be taken by sniffing along with the air into the air passage. Also it can be taken in a liquid form via the injection. So very often what the people used to do, take the same injection, and same injection is used by all the friends in a group. So that's why it can also transmit lots of other diseases, transmit through blood, maybe HIV AIDS, right? HIV AIDS, hepatitis, this type of deadly disease also can transmit due to this condition, that is they're taking by injection, or it can be also taken from that suppose area. They can take it as by snorting also. Okay, next one, what are the examples in different localities? It is called as marijuana, hashish, charas, or ganja. Okay, which is very common nowadays also in from different areas. A truck of ganja, they have been tracked by police officers. Why? Because it is having very high demand. Lot of people, they're taking this as a drug, and the people, basically the teenagers, they get dependent, which can cause lots of social imbalance. The people in this excitement or anxiety, they do a lot of antisocial things which is not been acceptable. They are indulge themselves to lot of crimes, right? So what are they? These are the cannabinoids. Examples, just remember: marijuana, hashish, charas, or ganja. After that, let us move to the third type of drugs. The next one, this is cocaine. This is also known as coca alkaloid, right? So what happened, this one basically interferes the receptor neurotransmitter. Actually, the transport of this neurotransmitter dopamine is been interfered, right? So whenever this coca alkaloid or this cocaine is taken, the neurotransmitter, that is dopamine, who actually is been transporting in the synapse region, that get blocked. So that's why the transmission of nerve impulse, that will be not possible. And yes, this is also acting as a hallucinogen. That means if that individual takes this coca alkaloid for a small period of time, they think themselves in a state of well-being, or that state is also known as euphoria or well-being. Suddenly he feel happy, right? And also, if in excess, if they take in excess, that can cause hallucination, right? So normally it is actually to the patient who are suffering from depression. As a drug, they can take this coca alkaloid or cocaine, that is prescribed by the doctors in a normal amount, right? But if that individual takes in excess, they can cause hallucination, and very often the people used to take it not as a drug prescribed by the doctors. They take it by their own choice, and they take it in abnormal or inappropriate amount, and they can be life threatening too. So just see from where it is extracted. It is extracted from Erythroxylum coca. Now it actually produces a sense of euphoria. Remember, it is a stimulant. Commonly it is also called as coke or crack, and it is known as an antidepressant. It is also induce excitement. Also, it can suddenly give that individual a feeling of happiness or well-being, or in excess case, this can cause hallucination. And very often the seeds of datura, this is also taken for its own property, misused actually as a drug. Okay, so these are the three different type of drugs. Now move to the next part. Now let's just move to the types of drugs. The drugs also can be divided into two types. One is psychotropic drug, another is known as a psychedelic drug. Okay, so the drugs can be of two types, psychotropic and psychedelic. So what is difference between the psychotropic and psychedelic drug? See, if it is psychotropic drug, then what happens? These people, they actually can alter the thoughts and their feelings. Okay, they completely affect the behavior and mental activity of the individual by taking some type of drugs like opioids, like morphine, smack, and caffeine, right? But if it comes to the psychedelic drugs, these are nothing but just the hallucinogens, right? So those hallucinogens, whenever it is taken by the individual without any type of actual stimulant, the individual will have extreme sense of well-being, or they completely change their world into a change of imagination, where it is said that actually it is a state like they can see the sound and hear the color. Actually, just think that what will be their mental condition, that without their stimulation, the individual will be in extreme imagination. That means he will be completely can't see anything. He will literally in the state of imagination, in the world of imagination, where every normal thing around them, he will not able to aware of it. The nervous system completely stops working. He will be completely in the state of hallucinogen, right? Now see the psychotropic drug. What are the examples? Basically, it is divided into tranquilizers, sedative, hypnotics, narcotics, and stimulants. Like examples, they are the morphine, snack, or caffeine. Right? If it comes to the psychedelic drugs, that can be of two type. We have the normal like datura, LSD, lysergic acid diethyl, bhang, ganja, charas, marijuana. These are the psychedelic drug, right? We can also have one type of synthetic hallucinogens. That will be a different type, that is actually cause a artificial, which is prepared in the laboratory. What are they? This is actually PCP and MDMA. This is PCP, which is also known as angel dust, which is taken by snorting or injection when the individual's central nervous system cannot work. His body activity will be completely out of his control, and he will be in a state of complete imagination, right? So these are the two type of drugs. Basically we can divide the psychotropic and psychedelic. If it's psychotropic, it swings the mind and it will affect the mental activity, and it will also turn behavior. And if it is psychedelic drug, then it will change the behavior, thoughts, and feeling without any actual stimulus, right? So these are the two differences of psychotropic and psychedelic drugs. Now let us move to the next part, that is tobacco chewing and the alcohol addiction. Okay, so just see this tobacco, it is taken generally, they can be taken generally taken chewed also, smoked also, or it can be snuffed also. Okay, so whenever they smoke cigarette, then lots of chemicals, a number of chemicals, they enter into the respiratory tract along with the nicotine, right? So whenever they smoke cigarette, it can affect the respiratory tract to a large extent. Okay, not maybe within days, but within years, it that start to accumulate inside our respiratory tract, and the air passage, the region, the areas of transporting or changing of the gases, they will start to reduce. It is not only that type of problem, that other type of problem are also associated. What are they? See, first of all, whenever they take it, it affect the adrenal gland, it stimulate the adrenal gland, and whenever it stimulate the adrenal medulla region, actually the hormones they start to release are adrenaline and noradrenaline. And whenever adrenaline and noradrenaline hormones are released, we know that adrenaline and noradrenaline, they are actually released in this suppose in the state of danger, whenever we get the instant energy. So suddenly heart beating, rate of blood pressure, they start to suddenly increase, right? So next one, blood pressure, heart rate, it will be increased. It can, yes, but in time, whenever that individual have the habit of cigarette smoking for years, then it can affect oral passage. It can develop oral cancer, lung cancer, and emphysema, coronary artery disease, then gastric ulcer. All the type of condition one individual can suffer due to cigarette smoking for years. Okay, but for a small period of time, it will act as a stimulatory effect on the adrenal gland, and the hormone adrenaline and noradrenaline, they will start to release, right? Now after that, let's just move to the next part, that is alcohol addiction. So this alcohol, whenever it is taken by the individual, first of all, what happen? The individual first of all will have dehydration. And why dehydration occurs? See, so whenever an individual takes the alcohol, then it affects the brain. Then after that, we know that from our body, the water reabsorption occurs, right? So whenever in the kidney region, water reabsorption is occurring with the help of the hormone ADH. Now, due to the alcohol consumption, this ADH hormone will not able to release properly, right? ADH hormone will not able to work. So that's why that individual will urinate a number of times. After consuming alcohol within 2-3 hours, that individual will micturate in a number of times, and that can cause dehydration. And to that condition, that individual will suffer from dehydration, and if that individual takes lots of water also, it can imbalance the body fluid level in the body, right? So this is the first thing it will happen, but otherwise lots of adverse effect will occur. So what are the effects? See, it can cause liver cirrhosis. Now, what is liver cirrhosis? Liver cirrhosis is a condition whenever we take suppose that alcohol, then it will readily mix in the blood. Blood comes to the liver carrying the nutrients. Now in the liver, the hepatocytes, they will get destroyed, and whenever the hepatocytes get destroyed, in that region some fibroblast cell start to replace those hepatocyte, and fibroblast cell, it will produce the fibers, collagen fibers will form. So in that region, the liver region will get hardened, and whenever it get hard, and at one period of time, liver will no more function, and it can cause liver failure or liver damage, right? And in that case, that individual will die due to liver cirrhosis. Okay. Next one, it can also cause fatty liver. In extreme cases, that fatty liver will convert into liver cirrhosis. Not only fatty liver, it will also cause fatty heart. That means around the heart also, that fat layer will start to deposit, right, due to alcohol consumption for a long period of time. Next one, this can also cause alcoholic hepatitis related to liver. It completely changes the willpower of the individual, mental balance. Emotions will not be controlled in to that individual. He will have incoherent speech. That means he will not have any control in his speech, right? Second thing, he will also not able to properly maintain his equilibrium, so that's why he will lose his balance too. Why? Because this alcohol, it will affect on the cerebellum. In our brain, the hindbrain cerebellum have a specific type of cell that is known as Purkinje cell. Purkinje cells are very much sensitive to the alcohol, and if the Purkinje cell, which is maintaining equilibrium of the body, because of what we are able to balance and we can able to stand, that will be completely hampered. So that's why after consuming alcohol, that individual cannot maintain his equilibrium, right? Next one, he will also have deposition of fat. I told already, the calcium metabolism will also get changed. That individual will have osteonecrosis. That means from the bone region, the upper part of the bone, they will start to erode. Okay, they can also cause bone destruction, that is also called as bone necrosis. Next one, that individual will have hormonal imbalance. Hormonal imbalance will include the adrenaline, then thyroxine hormone. All those hormones will be imbalanced. Due to what? It will affect the body to a large extent. So that is all about the different type of drug, alcohol, then cigarette, tobacco addiction we have seen. After that, let's just move to the last part. Now we will see the effect of the drug and alcohol abuse, and after that we'll see the prevention and control. First of all, let's just see the effect. If that individual get addicted to drugs or tobacco or alcohol, then how much thing will change to him? First of all, see behavioral and the psychological changes. First of all, if that drugs, they are affecting directly the nervous system and the hormonal balance, endocrine system, then what happens, that individual complete mood or the sense, the mental sense, that will be completely altered. So that personality of that individual will change. Next one, social problem. If that individual will have the mental imbalance, then also with the society he will not able to maintain proper terms. The terms relations with the society, with the family, with the siblings, with the parents will completely change. Next one, if that drugs that taken intravenously, that using the same injection, they are supposed taking the different type of drugs, cannabinoids or coca alkaloids, then what happen in the same peer, suppose in the group of friends, if one of them have suppose one disease like AIDS or hepatitis, then in that whole group, due to this alcohol or sorry, due to that drug injection with the same needle, that disease AIDS or hepatitis can can move from one person to the next person. Next one, misuse of drugs by sports person. See, there is a test, dope test is taken first of all in before the suppose sports have to be begun. Before that, in Olympics also we have seen a lot of sports persons, they are completely destroying their careers, like Maria Sharapova. She also had used those drugs to perform well in the sports, but it hampers the whole set of the sports, and not only the sports that is changed, but along with that person's life, along with that other sports person who is playing, or the other person who is actually deserving more, they also completely get rid, that will be completely in loss balance, is it? So that's why this is also one very bad impact on the field of sports. Next one, physical and mental growth is retarded. That individual in the teenage state or adolescent state, if they take the drugs and the alcohol, and this state is actually the state of mental development. So the individual physically he is growing, mentally is also he is growing. So if in that period of time, around 16, 17, 18, in that period of time, if they start to take that alcohol or drugs or tobacco, then it also affect the growth directly. He may have stunted growth, he will also have mental or mental power will be not that proper, or he will be not sharp. Okay, so these are the different effect, and also physically he will carry a lot of disease. Along with that, this type of imbalance with the society, with the whole world, they are carrying a very adverse effect, right? Now after that, we will see how many ways we can prevent that problem from our society, how we can stop the people from that alcohol or drug abuse, right? So see, first of all, avoid pressure. A lot of people in this world, in this society, we are in a rat race where we have to achieve something in every step, right? And we also try to we all always try to be in a state where we have to show, we have to compete with others. So in constant pressure, that individual take the drugs, and because of that, this will affect the individual. So if we don't have that pressure, if we don't have to compete always, every step and every day, then what happen, we do not require the drugs, right? So if we can avoid pressure, then also easily the life can be easier without taking all those drugs. Next thing, see, education and counseling is very much important. That's why this chapter is in your class. Why not in class 6, 7, 8? Why? Because in that period of time, this is very much actually sensitive period of time. We do not know which is correct, which is not. And whatever we think, we used to believe that this is correct. Okay, others advice we don't take, and we think that whatever we are doing, this is correct, right? So in that period of time, we somehow in a bad peer group, suppose, or in a suppose in a misleading group, then also it can affect. So that's why we have to avoid those people who can actually throw ourselves in that state to take the drugs or the alcohol. That will also have to be avoided, right? So that's why for them education and counseling is very much important, and for that reason we need to seek help from the parents, from the sibling, from the peers, and if it is not possible, take the medication, go to the rehab centers and take the advice. Why? Because very often they say that suddenly one individual in one day they cannot stop taking the drugs. If they stop taking the drugs, the nervous system will not able to work properly. He may have shaky hands, he may have fever. In that very small period of time, he will be completely uncontrollable, right? So that's why we need to have proper help, seek the help from the professionals, right? And we have to know also the danger signs, that if we prior to take the drugs and alcohol, if we know that it is going to hamper this way in our body, our liver can damage, kidney can damage, nervous system and endocrine system, hormonal balance will be completely lost, then in that tension we will not take the drugs, right? So this type of things can lead us to go in a correct, hygienic, proper, maintained lifestyle. Do not take the help from the drugs or from the alcohol or the tobacco. We can aware of it, we can aware ourselves, we can aware also the people around us, and this way we can have a proper healthy life without the tobacco, drugs or alcohol. So this is all about the prevention and control. Hope you have understood. That is all about the whole chapter, human health and disease. So we are going to complete the chapter in this part. So that's all about all those things. If it comes in exam, you have to write in detail. Don't write only these points, right? In the subjective exam, in those points, if you are writing, along with that also you have to describe it, right? So that's all about. Thank you.